The deep dissection of the neck involves 4 layers, starting with subcutaneous tissues and musculature, followed by vascular structures, skeletal and cartilage elements, and finally the spinal column. The dissection protocol requires examining the neck after the removal of the brain and thoracic viscera to prevent artifactual bleeding. In layer 1, the subcutaneous tissues beneath the ligature mark are typically white, hard, and glistening. Muscular trauma, such as the rupture of the platysma, occurs in 5 to 10% of cases, indicating significant violence. Hemorrhage is usually minimal under the mark itself. Layer 2 focuses on vascular injuries, particularly intimal tears in the carotid arteries. These transverse splits are a definitive antemortem sign found in 5 to 10% of cases. They are caused by violent traction and stretching, not direct compression. Carotid arteries must be explicitly open to the level of the mandible to demonstrate these tears. In layer 3, skeletal and cartilage damage, the hyoid bone fractures in 15 to 20% of hanging cases, mostly in older victims. The mechanism involves the ligature forcing the bone directly backward, causing outward displacement of fragments. Thyroid cartilage fracture of the superior horn occurs in about 40% of cases. Layer 4 involves the spine and Simon's hemorrhages. This finding is bleeding into the anterior ligaments and outer layers of the intervertebral discs, primarily isolated to the lumbar region. It's a pure traction artifact caused by the gravitational pull and prolonged suspension stretching the lower spine. To determine if death was antemortem, look for vital reactions. Indicators include dribbling saliva, the lymphasie sympathique neurological response, carotid intimal tears from antemortem vascular traction, and a vital tissue reaction showing abrasions with active hemorrhage at the ligature edges. The diagnostic matrix differentiates hanging from ligature strangulation. Hanging marks are oblique, non-continuous, and high on the neck. Strangulation marks are transverse, completely encircling, and below the thyroid. Neck tissues are stretched and hard in hanging, but extensively bruised in strangulation. Comparing deep neck structures, the hyoid bone fractures are less common in hanging and rarely seen in strangulation. However, thyroid cartilage fractures are highly common in strangulation, but less so in hanging. Trachea and larynx fractures are rare in hanging, but common in strangulation. Several pitfalls and autopsy artifacts must be avoided. A post-mortem ligature mark can be produced if a body is suspended within 2 hours of death. Removing neck structures en bloc without proper drainage can cause dissection artifacts. Lastly, overdistension of the pharyngolaryngeal venous plexus can create spurious blood collections that mimic bruising. A complete medico-legal picture requires integrating 3 elements: the scene's circumstantial evidence, the external mapping, and the internal dissection findings. A definitive ruling of suicidal hanging requires harmony across these factors, as no single sign exists in isolation.